If you're on Medicare, or you're helping a parent or a loved one with theirs, I need you to stop scrolling for the next 9 minutes. Because starting January 1st, 2026, there are at least 7 changes to Medicare that could either save you thousands of dollars or cost you thousands if you don't know about them. One of these changes affects almost every single person on a Medicare Advantage plan. Another one could get you kicked out of a plan you didn't even choose to leave. And one change, the one at the very end of this video, is the one nobody's talking about. But it could save the average person hundreds of dollars a year without you doing anything at all. Let's go through every single one. Stay till the end, because change number 6 is the one most seniors are getting wrong right now. Every year, Medicare updates its premiums, deductibles, and rules. Most years, it's small stuff. But 2026 is different. This is the year some of the biggest reforms in over a decade are actually kicking in. Things that were passed years ago are finally taking effect. And insurance companies know most people won't read the fine print. That's exactly why I made this video. I'm not selling you anything. I'm not a licensed agent trying to move you into a plan. I just want you walking into this year informed. So let's start with the one that hits your wallet first, the monthly premium. Here's the number everyone's been asking about. The standard Medicare Part B monthly premium is jumping to $200.90 in 2026. That's up from $185 last year, an increase of almost $18 a month, or roughly $215 more over the year. The Part B deductible is rising too, from $257 up to $283 a year. And if you're on Original Medicare and need hospital care, the Part A hospital deductible is climbing to $1,736 per benefit period, up from $1,676. If you end up in the hospital longer than 60 days, your daily coinsurance is also going up to $434 a day for days 61 through 90. Now, here's something a lot of people don't realize. If you're a higher earner, generally over $109,000 a year, you pay an extra surcharge on top of these premiums called ARMA. That threshold and those surcharge tiers have also been adjusted for 2026. So if you're near that income line, it's worth checking exactly where you land. None of this means panic. It means budget. Set that extra $200 plus aside now so it doesn't catch you off guard in January. Okay, here's the good news, and it's genuinely good. Starting January 1st, 2026, Medicare is using brand new negotiated prices on a group of expensive, commonly used prescription drugs. This is the first wave of drugs under the Medicare Drug Price Negotiation Program, and every Medicare Advantage and standalone Part D plan is required to honor these lower prices. If you take one of these medications, you could see a real drop at the pharmacy counter. Nobody can tell you the exact savings on camera because it depends on your specific drug and plan. But estimates suggest beneficiaries could collectively save well over $1 billion in out-of-pocket costs this year alone. And here's the second piece of this puzzle. Your annual out-of-pocket cap for Part D covered medications is now $2,100. That means once you've spent that amount on covered drugs in a calendar year, your plan pays 100% of the cost for the rest of the year. 2 years ago, that cap didn't even exist. People were paying thousands more. One more thing. If you have diabetes, the insulin price cap holds steady. You will not pay more than $35 a month for covered insulin. So call your pharmacist or your plan this month and ask directly, is any of my medication on the new negotiated list for 2026? That one phone call could save you real money. Quick one here. There's a program called the Medicare Prescription Payment Plan. Instead of paying a big lump sum at the pharmacy early in the year, you can spread your out-of-pocket drug costs evenly across all 12 months. If you signed up in 2025, listen closely. You are now automatically renewed for 2026 unless you actively opt out. So if your budget doesn't need that spread payment option anymore, you need to tell your plan, or you'll stay enrolled by default. This next part matters most if you're on a Medicare Advantage plan, and that's now roughly 35 million Americans. First, prior authorization is expanding. Starting in 2026, a 6-year pilot program is testing prior authorization requirements for certain services in original Medicare, not just Advantage plans. In 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. If you live in one of those states, your doctor may now need advance approval for select procedures or equipment that never required it before. If something urgent comes up, specifically ask your provider about expedited review. Most plans are required to offer one. Second, and this is the one most people miss, provider directories. For the first time, the official Medicare Plan Finder tool now includes each plan's provider directory. Sounds helpful, right? But directories can still contain errors. Doctors listed as in-network who actually aren't. Here's your protection. If you picked a Medicare Advantage plan this year based on directory information that turned out to be wrong, you now qualify for a special enrollment period to switch plans. My advice? Screenshot or print the directory listing the day you enroll. That's your proof if something's wrong later. Third, appeals just got easier. Starting in 2026, Medicare Advantage plans must follow new streamlined appeal rules. They have to clearly notify you of denials, treat more coverage decisions as appealable, and, this is big, they can't just walk back an approved inpatient hospital decision after the fact. Once your admission is approved, plans can only reverse it for obvious fraud or error, not just because they changed their mind later. If you've ever had a claim denied after the fact, this rule exists specifically to stop that. Here's the mistake I'm seeing most. People assume their plan from last year automatically carries over exactly the same. It doesn't. Every single year, Medicare Advantage and Part D plans can change their costs, their covered drug list, and their network, even if you don't touch a thing. So, if you didn't actively review your plan during the last open enrollment window, October 15th to December 7th, go check right now. Log into Medicare.gov or call 1-800-MEDICARE and confirm 3 things: your premium, whether your medications are still covered at the price you expect, and whether your doctors are still in network. Takes 15 minutes and could save you from a very unpleasant surprise at the pharmacy or the doctor's office. Let's run through it fast. 1. Part B premium and deductible are both up. 2. Part A hospital costs are rising too. 3. New negotiated drug prices could lower what you pay at the pharmacy. 4. Your Part D out-of-pocket cap is now $2,100, and insulin stays at $35. 5. You can spread drug costs monthly, and it auto-renews. 6. Prior authorization is expanding to 6 states for original Medicare. 7. You now have new protection if a plan's provider directory was wrong, and appeals just got easier. Look, Medicare changes every single year, and honestly, most of it is written to be confusing. My job with this channel is to translate it into plain English so you're never caught off guard. If this helped you, do me a favor, hit subscribe, because I'm covering the next open enrollment deadline before it sneaks up on anyone. And if there's a specific part of Medicare you want broken down next, Advantage versus Original, Medigap, or how to appeal a denial, drop it in the comments. I read every one of them, and I'm making that video next. I'll see you in the next one.